Transverse section of limb. What do you mean by transverse section of limb? A transverse section of the limb means a horizontal cross-sectional cut made across the limb, perpendicular to its long axis, like slicing a cucumber or sausage in rounds. This gives a circular or oval view of all the internal structures at that level. What you see in a transverse section, from outer to inner. 1. Skin. 2. Superficial fascia, fat plus superficial veins. 3. Deep fascia, forms compartments. 4. Muscle groups, divided into compartments. Example, flexor, extensor. 5. Bone. Example, femur, humerus. 6. Nerves and blood vessels, like femoral artery, sciatic nerve. Sample diagram of transverse section of limb. So, what is fascia? Fascia is a sheet of fibrous connective tissue that surrounds muscles, bones, nerves, and organs. Use simple analogy. Think of fascia like a plastic wrap that holds fruits, organs and muscles, inside a basket, your body. Types of fascia. 1. Superficial fascia. 2. Deep fascia. So let's talk about transverse section of the limb layer by layer. Skin, outermost layer of the body, divided into epidermis, superficial, no blood supply. Dermis, deep, contains blood vessels, sweat glands, nerve endings. Function, protection, temperature regulation, sensation. Superficial fascia, subcutaneous tissue, found just beneath the skin, composed of loose connective tissue. Fat, adipose tissue, contains blood vessels, lymphatics, nerves, and sometimes cutaneous muscles. Function, insulates the body, heat retention, stores fat, energy reserve, allows mobility of skin over underlying structures. Special notes, thin or absent in eyelids, scrotum, penis. Thick and dense in scalp, palm, sole, protective areas. Deep fascia, dense connective tissue sheath beneath superficial fascia, non-elastic and tough, rich in collagen, encloses muscles, forming muscle compartments, sends out intermuscular septa to bones, dividing compartments. Push-pin function, maintains muscle position, aids venous return, muscle pump, reduces friction during muscle movement. Stop sign absent in face, to allow facial expression, abdomen, to allow breathing, digestion, pregnancy-related changes. Muscle compartments. Muscles are grouped based on action, nerve supply, and vascular supply. Surrounded by deep fascia and separated by intermuscular septa. Examples, flexor group, anterior, extensor group, posterior. Bone, center of the limb, core structure giving rigidity and attachment for muscles. Surrounded by periosteum, vascular connective tissue. Also provides marrow space, hematopoiesis, intermuscular space, a potential anatomical space located between muscle compartments. Formed and defined by deep fascia, intermuscular septa, extensions of deep fascia, bones and muscles as boundaries. Anatomical structure, roof, deep fascia and overlying superficial fascia, skin, floor, bones and deeper muscle layers. Contents. The most important content here is the neurovascular bundle, usually arranged as VAN, vein, artery, nerve. Dividing compartments greater than the intermuscular space helps divide the limb into functionally separate regions. With the help of intermuscular septum, which is a modification of deep fascia, divides the limb into anterior compartment, front, posterior compartment, back. Each compartment has its own muscles. Nerve supply, arterial supply. Intermuscular septum, extension of deep fascia, runs from deep fascia to bone. Divides limb into functional compartments. Example, anterior and posterior compartments of the arm or leg. Contains neurovascular bundles, muscles, lymphatics, fascia. Neurovascular bundle. A neurovascular bundle is a structure that contains vein, V, artery, A, nerve, N. These three components run together through intermuscular spaces, surrounded and protected by fascia. Their arrangement is usually in the VAN order, from superficial to deep, or medial to lateral depending on the region. General arrangement greater than most parts of the body follow the VAN sequence. Example: intercostal spaces. The intercostal neurovascular bundle is an exception. Here, the order is NAV, nerve, artery, vein. Mnemonic: Navy sits on the rib, nerve is closest to the rib. Important exceptions: 1. First intercostal space follows NAV instead of the usual VAN. 2. Popliteal fossa, behind the knee. The order differs due to anatomical position. Located posterior to the knee joint. Important in surgeries and nerve blocks. Where neurovascular bundles are absent. Yes, there are areas where neurovascular bundles are not found. Superficial posterior compartment of leg. No neurovascular bundle passes here directly. Hilton's law reminder: don't forget this golden rule in anatomy. Hilton's law: the nerve supplying a muscle also innervates the skin over it and the joint it moves. That's the complete journey through the transverse section of the limb, from skin to bone. Every layer tells a story, every structure has a purpose, and now, you know them all. If this helped you understand anatomy better, then don't keep it to yourself. Like the video, share it with your fellow med buddies, and subscribe to Scrubs and Study for more high-yield content. Let's learn, grow, and achieve our medical dreams, together. Until next time, keep studying smart and stay inspired.